Welcome to the Surrogates Corner with James Mahan.
Greetings, everyone. Welcome back to part 2 with Dr. Aimee. This is the Surrogates Corner. I'm James Mahan, the founder of the Surrogates Corner. We're a law firm specialized on advocating for surrogates and donors in their journeys. Dr. Aimee, if you don't know her, you probably haven't been looking around very often. She's one of the most widely recognized medical professionals in the industry. She's affectionately called the Egg Whisperer. We'll have her back on to talk about egg donation journeys and what she's seeing in her practice. Dr. Aimee, thank you so much for your time and for joining us again.
It's so fun to be here. Thank you, James, for inviting me back.
So, Dr. Aimee, egg donation to me, we talked about surrogacy last time, seems like in terms of screening and what we're looking for is generally different for both ASRM and kind of what the clinics are doing. Can you talk us just through what you are seeing, recommending, and kind of what the industry is looking for in egg donors and egg donor candidates these days?
Absolutely. We're looking for young, healthy women, generally between the ages of 21 and 34. However, if someone has a connection to someone, let's say it's their sister or a best friend, I definitely will consider an egg donor who's even 37. I've even had a 41-year-old sister donate to her 43-year-old sister. I mean, that's not encouraged just because we know that the likelihood of success is lower. But just because an egg donor doesn't meet that age criteria that you might read on the ASRM website, it doesn't mean that that individual will not be a good egg donor for you. You just have to go in understanding what the chances are with eggs at her age. We're looking for women who are healthy. They are emotionally healthy as well as physically healthy, non-smokers, not using drugs. They haven't been on any psychiatric drugs within a certain period of time, and have a healthy family history, and they don't have any genetic diseases. And for me, I also look for genetic predisposition to, let's say, cancer. And we do a thorough family history and genetic screening. And, you know, not that you're asking me this question, but there's so much to go into as far as like frozen eggs and fresh eggs and transparency and how much information a family can have. But those are the general guidelines for picking an egg donor that we look for.
Because it seems to, from what I see in the contracts and everything else, a lot of it comes down to, have you been upfront about, like you said, things in your medical history, things that you know about that you do or don't potentially carry. It seems like there's obviously, for egg donors, a much bigger genetic component to what we're doing that we don't usually have on the surrogacy side. Are these things that most egg donors would know would be red flags for them? Or are there things that, you know, they may only find out about when they do the screening, or you know, what's kind of been your take on how, you know, candidates come to you and then either get passed because it's, you know, as long as they meet most of those criteria, they're probably going to be a good candidate, or if there are, you know, things that are bigger for them to kind of learn about themselves or realize might be problems for a prospective recipient of their eggs?
Yeah, I mean, what happens is you have a 25-year-old who's thinking about becoming an egg donor. And a lot of times they don't tell their family. So, and a lot of 25-year-olds, their moms are, you know, in their early 40s, and, you know, they haven't sat around the dinner table talking about, you know, what runs in the family. So a lot of these women, they actually don't know what's in their family history. So we have to rely on recall, like what they heard from, you know, conversations about grandma and grandpa and Uncle George. I just like the name George. It's just such a good name. But my point is that we really know very little about an egg donor's history when it comes to family history, because these are young women who they don't really know. So we do genetic screens, and we're basically doing a carrier screening looking at autosomal recessive genes. Then we do chromosome testing, but that also doesn't tell us the full picture. So this is why I personally think that it would be really nice for every egg donor to actually have a conversation with a doctor, even if it's a frozen egg bank donor for my patients. That would be my dream. But the reason why I love using fresh egg donors is I get to screen them. I get to ask for medical records from their past. I get to sometimes even talk to their parents. If there's a question about if the donor doesn't know things that I need to know about, then I can get more information. I mean, I have lots of sayings, and one of them is like, you know more about a puppy that you get and their genealogy and genetic history than you do the eggs from an egg donor. Sure. So I feel like with better tests looking at maybe whole genome screening in the future for egg donors, we'll get even more data. But for now, it's pretty pretty basic what we
Mhm.
learn. So, that's why sometimes doing genetic screening of embryos can be helpful when you're looking at chromosomes, but the chromosomes don't necessarily need to be run because egg donors tend to have healthier eggs because they're young.
Younger. Okay. Is some of that screening in terms of what they're looking for, or even the genetic type of screening, does that happen at an agency level, or I mean, do the frozen banks even do that, or is it kind of just something where it's so incomplete that they're really, like you said, the puppy from the dog store has a lot more about 5 generations back of blue ribbons that their grandparents got that we don't know about as much for egg donors. But is there a role for, or a place in the industry for someone to kind of fill that gap or to kind of help with that screening process?
Yeah, so I thought of having like a service once. So this was one of my many, many ideas that I could certify egg donors. Like I would personally review all their medical, like egg donors would get like certain certifications through me, where if they would provide all their medical records from birth,
Mhm.
and then I would review them, and then also their parents' medical records. Like, wouldn't that be amazing? Like you have
Yeah, that much
all this
access.
information because if you're not donor conceived, like I know my parents' medical history, I know
Mhm.
and I know what, so it's like that would be an incredible way of helping parents make decisions, intended parents make decisions about their choice. There just isn't anything like that. All
Mhm.
we're doing is asking the donor, like, when was your last pap smear? Have you had gonorrhea, chlamydia? Are you on birth control pills? Like, we're not actually verifying that they have any conditions by going through medical records since
Mhm.
birth. So, if I had my way, I would have a system in place to create different levels of certification for egg donors that would be willing to provide all of these records. And then parents could then pick an egg donor that has actually gone through that very thorough vetting up front. With some genetic screens, I mean, you can kind of replace some of that, but not all of it.
Not all of it. Yeah. Yeah, it always seems like in the old days of like picking a sperm donor based off of like height, hair color, eye color, and everything else was just kind of like coming out of the 80s and 90s, like the big thing. And now it definitely seems like parents are more in tune with the idea that there are certain qualities they're looking for, or a lot of it deals with genetic things that might come up, and it always seems concerning for me from where I sit that a lot of times the donors, I mean, usually the best ones are again in their early 20s and everything else, but they may not have a whole lot of information about even their siblings and other issues that might be in
Right.
their immediate generation family members about what's going on. And I just always know that's got to be a big concern for intended parents when selecting a donor, that it's not just a good picture in a book and in the right height or right eye color anymore. That there's definitely more that we want, but it just doesn't seem like that's kind of there yet for a lot of those prospective intended parents.
Right. And the genetic screening is just autosomal recessive genes. This isn't like proactive gene testing to see if they're increased risk of serious diseases, and chromosome testing. And most people have normal chromosomes.
Mm-hmm.
So when you try and, promote a donor and say she's genetically screened, I mean, it's really just for the matching process between the egg donor and the sperm donor to make sure that their shared genetics don't result in a baby that has a disease, which happens very rarely.
Mm-hmm. Okay. When it comes to the actual retrievals themselves, I have a number of donors who, are in their first retrieval cycle, some who are on their fourth or fifth. What is the current guideline for how many times a donor could do retrievals? Is there anything in terms of like how many eggs are retrieved that indicates good or bad in terms of what those egg quality, look like? I've had some donors that, they have 40 eggs pulled, and I always wonder what happens to all those eggs. But what in terms of like that kind of perspective are you seeing for either the ones who come out of the bank, so that do the fresh cycles, and then how many times can a woman donate her eggs before it becomes either problematic for her or just for population pool?
Yeah, I mean, I would say, well, ASRM guidelines is no more than 6 egg donations, and it's really to protect the egg donor's fertility, I think. And so when I meet with an egg donor, even if it's her first donation, I talk about my freeze and share program, not because I'm trying to steal the donor from the agency or anything like that. I just tell her, look, if you're going to do this again, I highly recommend that you consider donating and having half of your eggs frozen for yourself. And and a lot of them say things like, "I never wanna have kids." I'm like, "Well, you might change your mind later. Just trust me." But especially for the 6th egg donation, they should really consider doing that. And I think it's also to make sure that there aren't so many donor conceived, people from the same egg donor as
Mhm.
well. You don't, I think life is difficult already, and it can be challenging if someone doesn't realize that if they use an egg donor, that their child might have, 25 donor siblings.
Mhm.
And so you have to be prepared for that and realize that. And so that's why some patients actually prefer using a fresh egg donor, because they tend not to overdonate overdonate.
Mhm.
So when donors donate to egg banks, those eggs can get split up between like 4 families, and they'll do 6 donations. And you can imagine how many eggs are out there. And that same egg donor can go to the next egg bank and, they can lie. There's
Right.
no like central database where egg donors are registered with anything that's in any way, shape, or form to prevent that from happening.
Yeah. Is the number of cycles, is that in terms of the just the medication cycles, or is it the retrieval itself, or what aspect of the donation cycle is kind of the medical either harm or just risk towards the egg donor?
I think it's the multiple rounds of stimulation. The
Okay.
egg retrieval itself does carry risk. I mean, there's
Mhm.
risk of cyst rupture, internal bleeding, um, severe OHSS, which is a major complication that an egg donor can face. That's something that I talk to them all about, and how to prevent it, and things that they can do and what to look out for. And they have my phone number in case, they have any questions or they're experiencing discomfort after the egg donation. But I think multiple rounds of stimulation medications can potentially stimulate inflammation
Okay.
that is also known as endometriosis and adenomyosis and other hormone sensitive growths like fibroids. So there are some very famous stories of previous egg donors that have been screaming for years at the top of their lungs about what happened to them, where
Mhm.
they were an egg donor and it caused them to have severe endometriosis, and maybe they had it at the beginning and it just wasn't detected. And then by the time they were ready to have kids at a very even like a young age, like under 30, that they just weren't able to because of all the harm that the stimulation did for them. This isn't to scare people out of egg
Mhm.
donation. It's just to have women ask their moms before they go through, like, do you have endometriosis? Because we know it's genetic. If you're an egg
Mhm.
donor and you have, really painful periods, and it's getting worse over time, like you might have endometriosis, maybe being an egg donor is not a good idea for you because it might cause you to have fertility issues in the future.
Yeah. And I guess my hope and prayer is that they get that information like as they're going through the screening. I have a feeling from the, especially the donors I've talked to who go through egg banks or whatever other programs where it tends to be kind of a churn and burn, like just kind of getting as many eggs as we can, that's not really getting discussed with them or kind of openly talked about what risk may or may not exist on that side. Is there kind of a standard, not standard, but like is there a metric for how many eggs are retrieved that makes a donor seen as like a proven donor candidate versus not? And do we see any correlation between number of eggs and how many of them are either high quality eggs or result in high quality embryos?
Yeah, I mean, I think when you're retrieving, let's say, sometimes I do an egg donation and I can't help it because she just has so many follicles that
Mhm.
I'll get 40 eggs, but that's not
Right.
the goal, is to
Right.
get 40. I mean, I like to safely retrieve for an egg donor around 20 to 25. That feels comfortable. The donor is going to be uncomfortable after the egg retrieval, but I'm not worried about her safety or
Mhm.
her having a complication. Um, but certainly, even with 20 eggs, a donor can experience ovarian hyperstimulation syndrome. So donors should really make sure that the clinic that they're working with will use a Lupron trigger.
Okay.
So Lupron prevents OHSS. And
Mhm.
if the clinic is going to use HCG, sometimes I'll use a very tiny amount of HCG, even with Lupron, but we're talking about like 500 units or 1,000 units,
Okay.
but not 10,000 units. And I still hear stories of clinics who are cycling um, high egg producing donors and triggering them with 10,000 units of HCG, and these donors are ending up sick and in the hospital.
Mhm.
But I would say like a good donor for me is someone who has an AMH of over 2.0 and around 20 follicles or more. And
Okay.
then the dose of medications I use is, if they have 40 or 50 follicles, isn't so I can get 40 or 50 eggs, but so I can get around 20 mature.
Okay. And then one question that does come up, especially with some of my repeat donors, is there like a recommendation on how long they should stick around near the clinic, near kind of medical care before they hop on a plane and fly 5 hours to go home. I mean, I've heard of some of my donors who like do the retrieval, and I don't think they've been sent on the plane that same day, but like the next morning they're flying back, sometimes across the country. What do you normally see or do with your donors?
Yeah. So if it's a first time donor that's never done this before, I want her to recover here for 2 or 3 days because she's never done this before. She's going to be scared and afraid. And I can't visit, I can't see her or have her come to my clinic if she's living, 6 hours away by plane. So I highly recommend that you don't hop on a plane the next day, that you stay put. And if you're not feeling well, that you stay even longer.
Mm-hmm.
You extend your hotel stay. You change your flights. You make sure your companion can be there for you longer. You switch out companions if needed, and make sure you have adequate pain medication, electrolytes, salts, protein. You increase your protein intake. Like there's so many things that you can do as a donor to keep yourself safe throughout the process. But one of the worst things that you can do immediately after an egg donation as an egg donor, especially when you have over 20 eggs retrieved, is hop on a plane the next morning.
Mm-hmm. Yeah, no, that's great because we usually wind up putting in their contracts that like they're at least given 2 full nights to recover or whatever else, because a lot of it will come down to transportation costs and lodging costs and there's
Mm-hmm.
stuff like that. So I just wanted to get your feel from what you would like to see ideally, or kind of what things are there.
Yeah, I
Um,
mean, the additional cost of a couple of nights in a hotel is nothing compared to an emergency room visit that
right,
the intended parents
complication.
have to cover, or an emergency surgery or a blood transfusion.
Yeah, that's a great point. As far as, I mean, you mentioned a little bit about frozen eggs, fresh eggs, other stuff out there in terms of using those eggs to create embryos. What are you seeing on the egg donation side in terms of things that are going well, could be doing better, or that we need to change?
I mean, I think donors are being cared for in a safer way today than, let's say, 15 years ago. So that's good. I think what needs to change and change, throughout the industry of egg donation is, I firmly believe that all egg donations should be open. Same with sperm
Mhm.
donations.
Yeah,
I don't think there should be any anonymous or semi-open. I think children need to know their DNA roots at birth, just like someone who's adopted knows that they're
mhm.
adopted. It's very rare that you find someone that finds out that they're adopted at 18 years of age.
Right.
So there should be, people who are donor conceived should have that same information from birth. I don't think it needs to be on a birth certificate, although I've heard people advocating for that being donor conceived should just be as important as everything else on the birth certificate, but I don't feel like that's needed. I still think it should be it's private, it's
Mhm.
personal, but there should be disclosure from the start. And so I don't think we're doing still well with that.
Mhm.
And but I do see huge shifts. I finally met with an egg bank, Every, and they
Mhm.
allow families, intended parents, to actually meet the donors who've frozen their eggs. So
Oh, okay.
that's the thing. Like a lot of egg donors, they go through egg freezing at these banks, and like it's freeze and forget. And like maybe someone's going to knock on my door when I'm 18. I have no responsibility. This was just a financial transaction for me, so I can buy a a Louis Vuitton purse.
Right.
And egg donation is not just, you are investing so much of yourself, but it has implications for the rest of your life as an egg donor. And
Yeah.
so, I feel like egg donors are more mature now, and they're very excited to meet families,
Mhm.
and there's no hesitate. Like I would say almost 10 out of 10. It's more than 9 out of 10 of the egg donors that I meet when I'm screening about them. They always say yes, that they want to meet the families that they're donating to. So we're doing well with that. We could do
Yeah.
better though.
No, I mean, that's kind of anecdotally what I'm seeing also, at least from my donors who are very open to communication, who are open to sharing information about them that they do learn. I think the importance of like that genetic history that we're kind of becoming more aware of societally as a big thing we want to improve for people who are donor conceived. There's a lot of movements who are kind of working along with that. But it always seems like the intended parents, the recipients, tend to be the ones who are a little bit more, I don't know if they're still like, hands off, or they want to make sure that the donor is not going to come back and replace, one of the parents. But I feel like that's kind of dwindling a little bit.
Yeah.
But I totally agree with you. I think the idea of doing, I mean, I don't even like anonymous contracts when I see them. I always tell the donors, like, it says anonymous on their contract. It's not actually anonymous because you can be found pretty easily. So just know that. So, I mean, I would love to see the whole industry push towards, open and as much information as we can. If we're going to, like I said, removing the stigma around using a donor, just being very open with people about what their genetic history looks like. Because like you said, I mean, if you are conceived naturally and you're sitting around the kitchen table with your parents, you're going to know some of that stuff. If you're not, there's these huge gaps in your medical record and in your just knowledge base of who you are and where you came from and, what's there. That I think we need to do a better, just like you said, of trying to get that information to people and just being open about it. So yeah. I love that. Well, Dr. Aimee, thank you so much for your time. Everyone, thanks for tuning in to this 2-part episode with Dr. Aimee. We were thrilled to have her here. So much good stuff, insight, advice, and kind of things that we can look at both from the medical side of things and just the industry as a whole. Feel free to tune in, like, subscribe, share this information with anybody who's looking to do an egg donation journey. Always come back next time. Dr. Aimee, thank you so much.
Thank you, James.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.